Hello, I'm Kelly McCormick-Sullivan, CEO of the ASHP Foundation, and I'm here today with Dr. Katie Suda from the University of Pittsburgh Schools of Medicine and Pharmacy, our 2024 recipient for the Sustained Contributions Literature Award from the ASHP Foundation. Dr. Suda, congratulations on receiving this award. We're very honored to have you here today. If we could kick off by having you share with us how you got started in research.
Well, thank you, Kelly, so much for that kind introduction. And thank you to the ASHP Foundation for this recognition. My first research project was as a PGY1 resident, and that is where my entire research career started. In this project, I worked with pharmacy, infectious disease, patient safety, microbiology, and quality improvement to approach antimicrobial stewardship as a standard of care. We incorporated stewardship into multiple different areas of the health system. This included the formulary, micro lab decisions, and preventable medication safety events for unnecessary antibiotics. It was really rewarding to approach improving antibiotic use from multiple different angles and to help other departments in the health system achieve their goals. I know this is pretty routine now in 2024. However, this was very innovative in 1999. From a larger perspective, my first large federal collaborative research project was in the Veterans Health Administration. There we had clinical departments, epidemiologists, health economists, biostatisticians, nurses, pharmacists, physicians, psychologists, and veterans all collaborating together on research to improve veterans' health.
That's a remarkable interdisciplinary team and certainly a wonderful demonstration of collaboration. I'm wondering if you could share with our folks today, what do you see as the direct impact on patient care when it comes to your research agenda?
My ultimate goal is that every patient receives the medicines they need while avoiding the medicines that they don't need or where the risk outweighs any potential benefit. And it has been extremely rewarding to see my research inform regulatory standards, guidelines, and legislation. Even in clinical care, though, sometimes our research has also caused us to pause and to ask, why do we do what we do? Or why do certain patients get the medicines they need while others do not?
Very important questions to be pursuing. I'm curious if you could, again, maybe share a little bit of your thoughts or advice on how to get into research if you're just starting out or it's an area that perhaps you're curious about learning more.
There are 3 pieces of advice I wish I would have known when I was trying to launch a career in research. First, find a mentor. Second, allocate time. And third, start submitting. So first, you should find a mentor, and that mentor must have had a history of federal funding. This mentor does not need to be a pharmacist or be faculty in the College of Pharmacy. Feel free to cold call or cold email people who you think have skills that you would like to learn. Second, allocate time. Negotiate time with your supervisor for research. Block out time to write grants and papers, and be religious about protecting this writing time. Many of us did not go to pharmacy school to write, and that is also true for me. However, now I spend a large part of my day writing or reviewing documents. So take time to truly learn how to write grants. It really is an art. And there are training programs out there, including by pharmacy organizations, to help you obtain this skill. My third piece of advice is just start submitting. Start to submit those papers and actually get them in there. And start submitting grants. because you are not going to get any grants that you don't submit.
That's wonderful advice, Dr. Suda, and we are very grateful that you were willing to spend some time with us today. Again, congratulations on this very important award.
Thank you so much again for the recognition and the interest.